Ankle pain is a fairly common occurrence, and a large percentage of the population suffer from this during their lifetime. Sprained ankles, particularly in athletes, are a common cause of ankle pain. The lower leg bones, the tibia and fibula, come together to meet the foot bone, that is the talus, to form the ankle. Several ligaments hold these bones together. A complex structure of ligaments, tendons, muscles, and other soft tissues allows the foot and ankle to move. The complexity of this arrangement makes the ankle especially prone to injury. An ankle sprain happens when ligaments around the joint stretch or tear. Generally, there is a diffuse swelling all around and with limitation of movement due to the intense pain. Now, apart from rest, ice packs, compression bandage, and leg elevation, acupressure treatment can help you recover quickly from a sprained ankle. However, if the injured area looks crooked and there is asymmetry between the affected joint and the normal joint, with the inability to move the injured joint, surgical consultation is required. Chronic pain and stiffness in the ankle joint can result from ankle arthritis and is common in the elderly. Arthritis happens when the cartilage between the bones of the joint breaks down. The breakdown causes the bones to rub together, resulting in pain. If ever you experience acute pain due to an acute strain or even chronic ankle pain issues, then acupuncture or acupressure can be a saving grace. The following acupressure points have been found to be useful in alleviating ankle pain. The most important being is gallbladder 40 or GB40, and this point alone helps in tackling the ankle pain in most patients. It is located in the large hollow directly in front and inferior of the outer ankle bone. The next 5 points also play a significant role for associated ankle pains and may be used in conjunction with GB40. There are 2 points on the inside of the foot, namely kidney 3 and kidney 6. 2 points on the outside of the foot, namely bladder 60 and bladder 62, and 1 in front of the ankle, namely stomach 41. Now let's do a session of acupressure therapy for ankle pain. First, locate the hollow in front of the lateral malleolus and apply pressure for at least 3 minutes. Then apply pressure on the inner side of the ankle. Now locate a point midway between the medial malleolus and the TENDOACHILLIS tendon and apply pressure here for at least 1 minute. Next, apply pressure 1 thumb breadth below the medial malleolus. Now locate points on the outer side of the ankle. Similarly, a point between the lateral malleolus and TENDOACHILLIS tendon should be pressed for another 1 minute. Again, apply pressure 1 finger breadth below the lateral malleolus for another 1 minute. Now, after dorsiflexion of the foot, apply pressure on the most prominent crease over the ankle in the center. Continue the pressure for 1 minute. Lastly, don't forget to apply pressure on a very important point, that is Hego, located in the center of the web between the thumb and index finger. The pressure should be there for 1 minute. Apply pressure on all these points 2 to 3 times a day to get a good effect.